Now I come to the main thing, the helicase disorders and diseases. First, the ATRX helicase mutations. The ATRX gene encodes the ATP-dependent helicase. ATRX also known as XH2 and XNP of the SNF2 subgroup family. That is thought to be responsible for functions such as chromatin remodeling, gene regulation, and DNA methylation. These functions assist in a prevention of apoptosis, resulting in cortical size regulation, as well as a contribution to the survival of hippocampal and cortical structures, affecting memory and learning. This helicase is located on the X chromosome, XQ13, 1q21.1. In the pericentromeric heterochromatin and binds to heterochromatin protein 1. Studies have shown that ATRX plays a role in rDNA methylation and is essential for embryonic development. Mutations have been found throughout the ATRX protein, with over 90% of them being located in the zinc finger and helicase domains. Mutations of ATRX can result in X-linked alpha thalassemia, mental retardation, ATRX syndrome. Various types of mutations found in ATRX have been found to be associated with ATRX, including most commonly single base missense mutations, as well as nonsense, frameshift, and deletion mutations. Characteristics of ATRX include microcephaly, skeletal and facial abnormalities, mental retardation, genital abnormalities, seizures, limited language use and ability, and alpha thalassemia. The phenotype seen in ATRX suggests that the mutation of ATRX gene causes the downregulation of gene expression, such as the alpha globin genes. It is still unknown what causes the expression of the various characteristics of ATRX in different patients. Next, the XPD helicase point mutation. XPD, ectodermal pigmentosum factor D, also known as protein ERCC2, is a 5'3' superfamily 2. ATP-dependent helicase containing iron sulfur cluster domains. Inherited point mutation in XPD helicase have been shown to be associated with accelerated aging disorders such as Cockayne syndrome (CS) and trichothiodystrophy (TTD). Cockayne syndrome and trichothiodystrophy and both developmental disorder involving sensitivity to UV light and premature aging, and Cockayne syndrome exhibits severe mental retardation from the time of birth. The XPD helicase mutations has also been implicated in ectoderma pigmentosa (XP), a disorder characterized by sensitive to UV light and resulting in a several thousand-fold increase in the development of skin cancer. XPD is an essential component of the TF2H complex, a transcription and repair factor in the cell. As part of this complex, it facilitates nucleotide excision repair by unwounding DNA. TF2H assists in repairing damaged DNA such as sun damage. A mutation in the XPD helicase that helps from this complex and contributes to its function causes the sensitivity to sunlight seen in all three diseases, as well as the increased risk of cancer seen in XP and premature aging seen in trichothiodystrophy and Cockayne syndrome. XPD helicase mutations leading to trichothiodystrophy are found throughout the protein in various locations involved in protein-protein interactions. This mutation results in an unstable protein due to its inability to form stabilizing interactions with other proteins at the points of mutations. This in turn destabilizes the entire TF2H complex, which leads to defects with transcription and repair mechanisms of the cell. It has been suggested that XPD helicase mutations leading to Cockayne syndrome could be the result of mutations within XPD, causing rigidity of the protein and subsequently inability to switch from repair functions to transcription functions due to a locking in repair mode. This could cause the helicase to cut DNA segments meant for transcription. Although current evidence points to a defect in the XPD helicase, resulting in a loss of flexibility in the protein in cases of Cockayne syndrome, it is still unclear how this protein structure leads to the symptom syndrome. In ectoderma pigmentosa, the XPD helicase mutation exists at the site of ATP or DNA binding. This results in a structurally functional helicase able to facilitate transcription. However, it inhibits its function in unwinding DNA and DNA repair. The lack of cell's ability to repair mutations such as those caused by sun damage is the cause of high cancer rate in ectoderma pigmentation patient. Next, the RECQ family mutations. RECQ helicase. RECQ helicase, that is the 3' to 5' belonging to the superfamily 2 group of helicases, which help to maintain stability of the genome and suppress inappropriate recombination. Deficiencies and or mutation in RECQ family helicases display aberrant genetic recombination and or DNA replication, which leads to the chromosomal instability and an overall decreased ability to proliferate. Mutation in RECQ family helicase BLM, RECQ-L4 and WRN, which play a role in regulating homologous recombination, have been shown to result in the autosomal recessive diseases Bloom syndrome BS, Roth-Thomson syndrome RTS, and Werner syndrome WS respectively. Bloom syndrome is characterized by a predisposition to cancer with early onset with a mean age of onset of 24 years. Cells of Bloom syndrome patients show a high frequency of reciprocal exchange between sister chromatid and excessive chromosomal damage. There is evidence to suggest that BLM plays a role in rescuing disrupted DNA replication in replication fork. Werner syndrome is a disorder of premature aging with symptoms including early onset of atherosclerosis and osteoporosis and other age-related diseases, a high occurrence of sarcoma, and death often occurring from myocardial infarction or cancer in the 4th to 6th decade of life. Cells of Werner syndrome patients exhibit a reduced reproductive lifespan with chromosomal breaks and translocations, as well as large deletions of chromosomal components causing genomic instability. Roth-Thomson syndrome, also known as congenital, is characterized by premature aging, skin and skeletal abnormalities, rash, poikiloderma, juvenile cataract, and a predisposition to cancers such as osteosarcomas. Chromosomal rearrangement causing genomic instability are found in the cells of Roth-Thomson syndrome patients. This lecture may be helpful to you. Thank you. Welcome.